السلام عليكم طلاب. نبدأ محاضراتنا بالكورس الثاني. إن شاء الله اليوم راح ناخذ محاضرة الانفيرومنتال باثولوجي. شنو نقصد بالانفيرومنتال باثولوجي؟ نقصد اللي هي الديزيز caused by environmental causes, environmental agents, and refer to the environmental disorders including those encountered in workplace, physical agent, chemical agent, and of nutritional origin. الانفيرومنتال disease تكون مهمة لأن هي معظمها preventable. الetiological agents اللي play role in this category of disease هي nutritional factor, air pollutants اللي من ضمنها tobacco smoking, chemicals including drug, physical factor like ionizing radiation. نجي على الاير pollution. شنو معناته الاير pollution؟ معناته loading of atmospheric air with noxious gases, fumes and particles. pollutant mean agents in environment cause disease in exposed individual. هذه التوكسيسيتي مالتها نقسمها إلى two part, acute and remote effect. الأكيوت أو البروكسيمال effect ب two mechanism of action. أكو direct action اللي هي تسوي لنا inflammation و necrosis، والindirect that stimulate the immune system and producing tissue damage. Distal effect or the remote effect تشمل لنا chronic inflammation leading to the fibrosis and degenerative organ malfunction. Air pollution, it is the worst in the industrialized areas, and the affected organ are the mostly affected organ هي lungs لأن هي معظمها fumes and gases. Air pollutant contribute to the causation and aggravation of many lung disease. Example of environmental lung disease تشمل لنا chronic obstructive airway disease اللي هي chronic bronchitis and emphysema, laryngitis and pneumoconiosis. Changes باللنج راح تكون من minor irritation, fibrotic disease to cancer. Factors that determine injurious potential of air pollutant تشمل لنا water solubility, size, concentration, duration of exposure, reactivity and clearance mechanism of the body. فالwater solubility الإكزامبل عليه ال SO2. This is dissolved in the secretion of the upper air passages لذلك يسوي لنا irritation. The particle size إذا 0.5 micron in diameter, it is act like a gas. 1 to 5 micron, mostly dangerous, impacted at the distal airway passages, engulfed by macrophages and stimulate the neutrophil to produce mediators leading to the inflammatory reaction. More than 5 to 10 microns in diameter don't reach to the distal airways. Concentration, directly, this is related to the effect agent to produce. The SO2 concentration, يعني the effect of SO2 depending on its concentration. If it is the concentration less than 0.2, it causes eye irritation. If 2 to 5, it increase airway resistance, and if more than 20, it decreases in mucociliary clearance and cause pulmonary edema. Duration of exposure, طبعا نعرف كلما زادت the duration of exposure راح تزداد الeffect. Reactivity of pollutant, الكول داست يعتبر inert, silica, asbestos and beryllium تكون more reactive. Host clearance mechanism, في حالة الانفيزيما والكرونيك برونكايتس يصير عندنا impaired clearance mechanism، فراح يصير عندنا higher accumulation of toxic substances. نجي على tobacco smoke. This is associated with highest prevalence of diseases. التوباكو smoke تحتوينا على two substances. الأولى نسميها الكارسينوجينز and tumor promoters. الكارسينوجينز اللي موجودة بالتوباكو سموك تشمل التار, polycyclic aromatic hydrocarbons, benzopyrene and nitrosamine. Promoters include nicotine and phenol. This is the adverse effect of smoking. طبعا كلكم تعرفون الeffect of smoking يبدي من الأورال كافيتي وينتهي بالبلاد فيزل. بالأورال كافيتي زيد لنا الانسيدنس اوف سكويموس سيل كارسينوما، باللارنكس، بالاسوفيجاس، يسوي لنا كانسر اوف ذا لانج، كرونيك برونكايتس اند انفيزيما، بيبتيك ulceration, cancer of the pancreas, of bladder and increased systemic atherosclerosis. Cigarette smoking is the commonest cause of chronic obstructive airway disease and most important cause of lung carcinoma. طبعا having the direct irritant effect on the tracheobronchial mucosa leading to the inflammation and increase mucus production. لذلك تشوفون اللي يدخنون دائما عندهم من يقح يطلع سبيوتم. ليش؟ لأن زيادة الميوكس برودكشن. زين، هذا السموك راح يسوي لنا recruitment of leukocytes هذه الميكانيزم ليش دا يصير عندنا انفيزيما بالسموكرز؟ يصير recruitment of leukocytes. Leukocytes to produce elastase, زين, leading to the damage of the lung elastic tissue وتسوي لنا الانفيزيما. Destruction of elastic tissue leading to the emphysema. Heart and smoking. تعرفون إنه الأثيروسكليروسيس strongly linked to the smoking due to the acceleration of atherosclerosis, increase platelet aggregation, يزيد الترومبوتيك incidence, decrease myocardial oxygen supply, lung disease interfering with oxygenation of blood, والcarbon monoxide content of smoke leading to the hypoxia, increase oxygen demand. Smokers are liable for ventricular fibrillation and sudden death يكون higher in smoker than non-smokers. Pneumoconiosis. شنو نقصد بالpneumoconiosis? Pneumoconiosis, it is a group of lung disease resulting from inhalation of specific organic and inorganic dust particulates. Basically, it is occupational disease, usually occur in people living near industries. The most serious disease include coal worker pneumoconiosis اللي هو نتيجة coal dust accumulation, silicosis اللي هي caused by silica particles, and asbestosis اللي هي caused by asbestos particles. المينرالز أو الانورجانيك داست تشمل مثل ما ذكرنا coal dust, silica, asbestos and beryllium. هذا الدست ما راح يدخل إلى اللنج، زين. مثل ما ذكرنا راح يعتمد على many factors. الإفكت مالته يعتمد على size of the particles, concentration, duration of exposure, reactivity of the tissue. Most of the inhaled dust is removed by entrapment in mucus blanket followed by ciliary movement ويصير له extrusion to the outside. Some particles impacted at the alveolar duct bifurcation. It will be phagocytosed by macrophages, زين. And trigger macrophage to release a product toxic to the lung, trigger mediate inflammatory response and initiate fibroblastic proliferation and collagen deposition leading to the fibrosis. هذا هو pathogenesis. The mediators that will be produced it include oxygen free radicals, proteases, leukotriene B4, interleukin 6 and 8 and tumor necrosis factor. هذا هو الباثوجينيسيس، انه هي when it will يعني enter to the airway passages, it will be engulfed by the macrophages and stimulate the macrophage to produce fibrogenic factors and effect on toxic factor with activation of the leukocyte to produce many mediators leading to the fibrosis of the lung. نجي على الكول worker pneumoconiosis. This is occurred due to the inhalation of coal dust particles. It is either asymptomatic anthracosis. احنا تجمع or accumulation of the carbon called anthracosis. It is either cause asymptomatic anthracosis or simple cool worker pneumoconiosis or complicated type اللي هو progressive massive fibrosis. اللي هو يكون أما complicate simple cool worker pneumoconiosis or fibrosis is extensive and the lung function severely affected. هذا الcool worker pneumoconiosis may be complicated by TB اللي هو يكون secondary TB. هذه هنا gross هذه lung of patient suffering from cool worker pneumoconiosis or accumulation of the or anthracosis يعني accumulation of carbon particles. وهذه هنا ال two areas اللي هي site of TB. This is aqueous necrosis. هذا هنا السكشن مو كلش واضح ولكن هو إذا تشوفون هنا أكو distracted alveoli and massive fibrosis of the lung tissue with dark discoloration in the tissue اللي هو الcarbon particles. This is also the lung of patient with cool worker pneumoconiosis. شوفوا الأماكن اللي طالعة dark in color اللي هي الأكيوميليت والأماكن اللي صايرة الكلر مالتها يعني جريش هذه هي مكانات الفايبروسيس. الإكس راي this is the X-ray of patients suffering from cool worker pneumoconiosis, not the bilateral opacity of the lung. About 75% of this lung is affected, and this is nearly all the lung are affected by accumulation of cool dust. This is another slide showing the distracted alveoli with fibrosis and presence of dust particles in the tissue or cool carbon particle inside the tissue. This is a cool worker pneumoconiosis. هذه at higher magnification power. شوفوا هنا هذه الكربون particles اللي موجودة بالتشو. This is engulfed by macrophages. This is a complicated cool worker pneumoconiosis. هذه هنا عندنا الالفيولاي distracted وهذا massive fibrosis with black discoloration. هذه ايضا هنا يوضح لنا ال black discoloration او carbon deposition inside the lung tissue. نجي على another example is the silicosis. This is the most prevalent chronic occupational lung disease caused by inhalation of crystalline silicon dioxide particles. This required several decades for exposure to produce the disease. It is a slowly progressive nodular fibrosing pneumoconiosis encountered in mining of metals, whether gold, copper, and coal, sandblasting, metal grinding, and manufacturing of ceramics. A gross feature, this in the early stage, there is tiny discrete pale nodules up to 0.5 cm in diameter in the upper zone of the lung. With the progression, these nodules become larger and coalesce together, forming a collagenous scar with the contraction of the loop of the lung, mostly upper loop, and leading to the secondary expansion of the lower loop. These nodules blackened by accumulation of coal dust, and the fibrotic nodule encourage on adjacent bronchioles and branches of pulmonary artery, lead to the hyperinflation of the related alveoli and pulmonary hypertension. This may be complicated by TB. Cavitation when present should arise possibility of intercurrent TB. Hilar lymph node and pleura may be involved. Microscopical feature of silicosis راح نشوف discrete hyalinized collagenous nodule. Collagen lie down in concentric layer and layer separated by clefts containing the crystalline spicules of silica. هذه بالH and E. وبالpolarized microscopy راح نشوف birefringent silica particle. This is the hyalinized nodule of the lung. This is massive fibrosis of the lung. هذه هنا alveoli وهذا هو massive fibrosis of the lung. واكو هنا plaque ايضا discoloration. This is the collagenous nodule, destruction of the tissue by fibrotic process with the presence of the cool dust particle inside the lung tissue. This is in H and E stain. بينما بالpolarized light microscopy راح نشوف انه هاي البايرفرنجنت particles اللماعة هي هذه الكريستالين السيليكا بارتيكلز. هذه الاماكن اللي طالعه بايرفرنجنت يعني لماعه هي هذه الكريستالين بارتيكلز. اوكي عفوا سيليكا بارتيكلز. This is also the same. This is a X-ray, chest X-ray of a patient with silicosis. هذه الopacity، هذه opacity، هذه opacity، هاي الاماكن اللي فيها opacity. هذه بالسكشن هنا fibrosis وبالليت ستيج يصير عندنا fibrotic nodules. The clinical feature, this is detected by routine chest X-ray. نشوف nodularity in the upper zone, shortness of breath late in the course of the disease, and become progressive even if exposure discontinued. ليش؟ لأن من تبدي الفايبروسيس باللنج it will be progressive. Disease impairment of lung function, and there is increased susceptibility of TB. No evidence of increased risk of lung cancer in the silicosis. نرجع على asbestos. This is another family of crystalline hydrated silica. Exposure to the asbestos lead to the هذا الاسبستوز شوية خطر مو مثل السيليكوسيس. Lead to the parenchymal interstitial fibrosis يسموه asbestosis, bronchogenic carcinoma, pleural effusion, fibrous plaque of the pleura هذه rare, mesothelioma of the pleura and peritoneum, and laryngeal carcinoma. إذا هذا the incidence of carcinoma. Asbestos has the following effect: induce cellular and fibrotic lung reaction and act as a tumor initiator and promoter. Asbestos fibers عندنا two form. أكو serpentine crystal. This is a fiber تكون curly and flexible والstraight and stiff اللي هي amphipole fiber. Amphipole طبعا هي تكون pathogenic more than the serpentine. Both form of asbestos fiber are fibrogenic. Increased doses of exposure cause more pathology and more related diseases. It will cause diffuse pulmonary interstitial fibrosis, extensive pleural fibrosis, and there will be asbestos bodies. It can golden brown, fusiform or beaded rod, consist of asbestos fiber coated with an iron-containing proteinous material. Process start as fibrosis around respiratory bronchioles and alveolar duct and extend to involve the adjacent alveolar sac and alveoli. This is the lung in asbestosis. شوفوا هذا الفايبروسيس يطلع عندنا هذا اللون اللي هو جراي على بياض، هذا هو الفايبروسيس of the lung. الكاركترستيك فيتشر of the asbestos هي الاسبستوس بودي. هذه هي رود تكون لكن تكون beaded. Okay. This is the asbestos body by H and E. وهذه ايضا هي الاسبستوس بودي. هنا هذا asbestos body inside a giant cell. هذه multinucleated giant cell. زين. وهذه ايضا هذه lung carcinoma. شوفوا هذه malignant cell around the asbestos body. Pleural plaque, most common manifestation of asbestos exposure. It consists of collagen and calcium occurring in the parietal pleura. Incidence of bronchogenic carcinoma is 5 times higher in the asbestos than the general population, and incidence of mesothelioma is 1,000 times higher compared to general population. Asbestosis causes progressive destruction of lung tissue, dyspnea, and respiratory failure with pulmonary hypertension, right ventricular hypertrophy, and right ventricular failure أو right-sided heart failure. أكو فد syndrome يسموه Kaplan syndrome اللي هو fibrotic nodule in both lungs with rheumatoid arthritis. يصير لنا بالكول ووركرز بالسيليكوسيس وبالاسبستوز. هذه النوديول it is a modified rheumatoid nodules having central zone of dust-laden fibrinoid necrosis. نجي على another type of cool worker pneumoconiosis is the Berylliosis. This required heavy exposure to the dust or fumes of metallic beryllium or the oxide salt, leading to the acute pneumonitis, and exposure to the low dose for long period leading to the pulmonary granulomatous lesion similar to the sarcoidosis. This is the environmental cause. نجي هسه على injury by chemical agent whether it is therapeutic or non-therapeutic. طبعا therapeutic influenced by many factors: dose, metabolic conversion, site of absorption, accumulation and excretion, individual variation, and capacity of inducing immune responses. نجي على therapeutic agent. نبدي بالexogenous estrogen. This is used in postmenopausal women to slow adverse effect of osteoporosis. لكن السايد افكت مالته شنو هي؟ endometrial carcinoma 3 to 6 times after 5 years of exposure, risk reduced by addition of progesterone, and breast carcinoma this is a small increased risk. or هذا بالنسبة للإكزوجينوس استروجين. الأورال contraceptive pills الادفيرس افكت مالتها هو increased risk أو incidence of cervical carcinoma, thromboembolism, hypertension, hepatic adenoma, and gallbladder disease. Acetaminophen اللي هو الباراسيتول يسوي لنا centrilocular hepatic necrosis, toxic dose between 15 to 25 gram. Clinical toxicity began with nausea, vomiting, and diarrhea. Later on, there will be jaundice and eventually leading to the hepatic failure. Acetylsalicylic acid or the aspirin, it causes respiratory alkalosis, metabolic acidosis. The toxic dose in the children 2 gram, while in the adult it is 10 to 30 gram. Chronic aspirin toxicity occur in patients with a chronic inflammatory condition like rheumatoid arthritis لأن هذولا ياخذوا باستمرار. Average of 3 gram per day or more, manifested by headache, dizziness, tinnitus, mental confusion, nausea, vomiting, diarrhea, GIT bleeding, نتيجة acute erosive gastritis and blocking of thromboxane A2 formation. النون-therapeutic toxic material مثل عندنا الليد poisoning. هذا فد موضوع مهم. عندنا two form of lead poisoning. Acute lead poisoning, this is unusual circumstances. يصير بالباتري burning من يحرقون الباتريات. و slow accumulation of lead compounds over period until reach the toxic level. Manifestation in the adults differ from the children وهو more common بالchildren طبعا. بالادلت يصير عندنا colicky abdominal pain, fatigue and headache. بالchildren يصير عندهم encephalopathic crisis. السورس منين يجي؟ يجي عن طريق الجاستروانتستينال تراكت or the lung. الميجر سورس هو الاير, soil, water and food. Lead of urban air remain significantly high deposit reduction in use of lead gasoline. والvolatilized lead is particularly hazardous and rapidly absorbs to the lung. Ingested lead اللي هو only 10% is absorbed in the adults بينما بالchildren 50% will be absorbed. مين يجينا بالchildren؟ هو من السويل contamination، من التراب، إذا يلعب بالتراب ياكل يحطه بحلقه frequently، وفليكينج lead paint in older houses. هذول جماعة الأنيميا، أكو أطفال عندهم أنيميا، يحاول إنه يحك الصبغ اللي موجود على الباب، على سرير، ويسوي له ingestion. طبعا هذا بكميه عاليه من الليد فيكون source for the lead poisoning. الديبوزيشن of the lead راح يكون بالبون and teeth اللي تقريبا 80% of absorbed lead، بالبلاد 10% and throughout soft tissue 10%. بالchildren راح يصير بي accumulation بالابيفيسز of the bone، فراح يعني it will be interfere with the normal remodeling. زين، فتزداد البون density، يطلع لنا ليد لاين بالراديوغرافز هسه اشوفكم يعني. ايضا يصير له ديبوزيشن بالجم، فيصير عندنا هايبر بيجمنتيشن adjacent to the teeth and excretion via the kidney. It will cause damage to the kidney. The neurological feature, it will be including sensory, motor and intellectual impairment, retarded psychomotor development and blindness. هذا هو الليد لاين اللي حكيت لكم عليه نتيجة accumulation of the lead in the epiphysis of the long bone. هذه هي الهايبر بيجمنتيشن of the gum around the teeth نتيجة accumulation of lead. طبعا هذه لستة من الكلينيكال والباثولوجيكال فيتشر اللي يسوي لنا اياها الليد بويزنينج. يعني بالبرين يسوي هيديك، ميموري لوس، بالchildren انكفالوباثي ومنتال ديتيريوريشن، جنجيفال ليد لاين، بالبلاد يسوي انيميا لكن تطلع في شيء significant بالريد بلاد سيل يسموها بيزوفيليك ستبلينج. بيروفرال نيرف يسوي لنا ديمايلينيشن، بالكدني يسوي كرونيك تيوبولو انترستيشال ديزيز، بالجي اي تي ابدومينال بين، وبالبون يطلع لنا الراديو دنس لاين وخصوصا بالchildren. Another type of poisoning, it is the CO poisoning produced by imperfect oxidation of carbonious material, killed through the CNS depression, act as a systemic asphyxiant, and carboxyhemoglobin is incapable of carrying oxygen. 20 to 30% of hemoglobin saturation leading to the systemic hypoxia, 60 to 70% saturation يسوي لنا unconsciousness and death. Acute CO poisoning يسوي لنا cherry red discoloration of the skin, a brain will show punctate hemorrhage. Alcohol, this is another example of hazardous environmental disease. Acute consumption affect principally the CNS, chronic consumption affect the CNS and other organ. نجي على acute intoxication, it causes depression of subcortical structure, stimulation and disorder behavior of cortical motor and intellectual behavior, depression of medullary center and cortical neuron, and cause acute gastritis and ulceration. The chronic intoxication اللي هو الكرونيك ethanol consumption increase blood level of acetaldehyde. والacetaldehyde هو major oxidative metabolite of methanol and it is a mediator of widespread tissue and organ damage. فعلى الليفر راح يسوي لنا fatty liver, alcoholic hepatitis and alcoholic cirrhosis. بالجي اي تي يسوي gastritis, gastric ulcer and esophageal varices. بالCNS leading to the deficiency of thiamine and the result تكون peripheral neuropathy and Schwarzkopf psychosis. على الكارديوفاسكولار system dilated congestive cardiomyopathy. This is the effect of chemical agent. نجي على الانجري by physical agent واللي احنا من ضمنها قلنا ionizing radiation. The type of injury depend on the type of the object, amount of injury, discharge at impact, and tissue or organ bearing the impact. The pattern عندنا physical injury اللي هو التروماتيك أو الwound, abrasion caused by scraping or rubbing يعني removal of superficial layer of skin, contusion or bruises هذه يسبب blunt object يسوي damage to the blood vessel و extravasation of the blood into the tissue, laceration caused by blunt object, tear of tissue and يسوي لنا wound with irregular age, incised wound produced by sharp instrument, penetrating wound, narrow instrument pierces the tissue, and perforating wound caused by instrument transverse tissue creating an exit wound. هذا هو laceration of the tissue بالhand. This is the incision. Thermal injury هذا second type of physical هو thermal injury, thermal burn, partial thickness burn اللي هو first degree epidermis including the epidermis only, second degree epidermis and superficial dermis, and full thickness burn. This is total destruction of epidermis, dermis, and loss of dermal appendages. Microscopically, there will be devitalization of the tissue, show coagulative necrosis, and the adjacent to vital tissue show an inflammatory reaction. Consequence of thermal burn يسوي لنا hypovolemic shock if it is involved more than 20% of the surface. Infection خصوصا بالسيدوموناس aeruginosa, staph and candida due to the loss of skin mechanical barrier, impairment of immunity, cellular and humoral, impairment of lymphocyte macrophage function. Hypermetabolic state, excess heat loss, and increased need for nutritional support. Hyperthermia اللي هي تشمل لنا الهيت cramps of voluntary muscle due to the loss of electrolyte via sweating. Heat exhaustion results from failure of cardiovascular system to compensate for hypovolemia secondary to water depletion. Heat stroke, this is due to the high temperature and high humidity. There will be failure of thermoregulatory mechanism with excessive sweating. Core body temperature will be rise, generalized peripheral vasodilatation with peripheral pooling of blood. Ultimate effect, there will be necrosis of the muscle including myocardium, arrhythmia, and DIC اللي هي disseminated intravascular coagulation. Hypothermia, when the body temperature fell below 90 Fahrenheit, loss of consciousness, bradycardia, and atrial fibrillation. Slowly developing drop of surrounding temperature, chilling, there will be vasoconstriction, increased vascular permeability, lead to the local edema and subsequent atrophy and fibrosis. Sudden and sharp drop in the surrounding temperature lead to the vasoconstriction and increased viscosity of blood, leading to the ischemia and degenerative changes in the peripheral nerves. Electrical injury اللي هو يشمل لنا البرن, ventricular fibrillation, or cardiac and respiratory center standstill. Injury by ionizing radiation. Ionizing radiation two form, electromagnetic waves اللي هي الإكس-راي والجاما راي, and high energy neurons and charged particles اللي هي الألفا and beta. Effect of ionizing radiation on the tissue and the cell. طبعا راح يسوي لنا DNA damage compatible with survival in intermitotic phase. During mitosis, the cell with irreparable DNA damage die. Tissue containing rapidly dividing cell like bone marrow and GIT mucosa show evidence of radiation injury. At molecular level, there will be DNA suffer of pyrimidine dimer, cross-link, single strand break اللي هو repair within minutes, double strand break, this is unrepairable, and various rearrangement. These alterations lead to the structural changes in the chromosome, including deletion, breaks, translocation, fragmentation, mitotic disorder اللي هي الانابلويدي or polyploidy, وبالتالي راح يسوي لنا genetic disorders. At the cellular level, there will be nuclear damage, nuclear swelling, condensation, clumping of chromatin, giant cell with pleomorphic nuclei, cytoplasmic damage, cytoplasmic swelling, mitochondrial distortion, degeneration of endoplasmic reticulum. These changes are similar to the changes of the malignant cells or cancer cell. Vascular changes including vasodilatation at early stage, degenerative changes including endothelial swelling and vacuolation, rupture, thrombosis, endothelial cell proliferation, collagenous hyalinization with thickening of the media, and narrowing and obliteration of the vascular lumina. On the organ, it will cause hemopoietic and lymphoid tissue, lymphopenia, shrinkage of the lymph node and spleen, granulocytes. It will increase first in number and then fail in the end of the first week. Recovery need 2 to 3 months. RBC, there will be anemia, occur after 2 to 3 weeks due to the marrow damage, cancerous transformation, dividing cell acquired mutation, increased incidence of neoplasm occur in any organ. Radiation in very large dose will kill the cells. آخر موضوع في environmental هو nutritional disease. بالنسبة للنيوتريشنال ديزيز عندنا basic principles اللي هي total nutritional requirement equal to the basic requirement plus additional or adaptive requirement during disease, pregnancy and lactation and growth. Requirements met by oral intake and artificial support. Adequate food intake اللي يكون أما deficiency state, anorexia, and change in the immune status, and malnutrition including malnutrition and obesity are common. نجي على normal dietary requirement. This is defined as one in which contents of various nutrients are sufficient to maintain optimal growth and function of the body. Metabolic effect of starvation depend on the duration of starvation, including continuous utilization of glucose. طبعا هذا هنا ايش راح يصير في حالة الستارفيشن بالجوع، المجاعة أو الجوع، الخلايا ايش راح تبدي تستخدم؟ راح تبدي تستخدم أول مرة الجلوكوز الموجود، وبعدين يصير عندنا فيل بالبلاد جلوكوز. ورا ما ينزل البلاد جلوكوز يتجه الجسم إلى الهيباتيك جلايكوجين يسوي له بريك داون حتى يطلع جلوكوز for the ATP production. ورا ما يصير عندنا هيباتيك exhaustion ينتهي، يبدي عندنا الجلوكونيوجينيسيس اللي هو production of the ATP from the protein of the muscle. فبهالحالة ايش راح يصير عندنا excretion of the urea يزداد. increase fat breakdown ورا ما تخلص مرحلة انه استخدم المصل for the source as a source for ATP، يستخدم وراها الاديبوز tissue. adipose tissue leading to the accumulation of ketone body. طبعا ketone body used as a source of energy by nervous tissue. decrease glucose requirement يقل gluconeogenesis, decrease protein catabolism, decrease urea in the urine, and in advanced starvation راح يصير عندنا acidosis and accumulation of ketone body that will be excreted by the kidney as ammonium cation. Result of this adaptive process راح يصير عندنا انه الميجر energy store mobilized in such way as to prevent protein breakdown. الجسم يحتاج تقريبا حتى يستهلك الاديبوس تيشو الستور الموجود به يحتاج من 40 الى 70 يوم، والتوتال بودي بروتين يحتاج من يعني اللي هو 9 الى 11 كي جي، والمصل بروتين هي من 3 الى 4 كي جي ما يقارب يعني. لذلك المصل ستور ينطينا سرفايفر about 75 days 75 يوم، يعني تقريبا الانسان اذا ما ياكل 3 اشهر يقدر يقاوم جسمه باستخدام هذه السورسز المختلفه. النيوتريشنال ديفيشنسي مقسمه الى تايب 1 and تايب 2. التايب 1 بي specific sign and symptom زين reflecting reduced tissue concentration of such element or nutrient as iron, iodine and vitamin D. Type 2 reduction in the growth rate as in protein energy malnutrition، هذا تاخذوه بالتفاصيل ان شاء الله بالاطفال. Effects يكون more severe and usually affect the infancy and early childhood. Protein energy malnutrition characterized by loss of adipose tissue and tissue protein. The skin تكون thin, inelastic and the hair dry and fail easily. هذه يصير بالمجاعات بافريقيا دائما يطلعوا هذول very thin ذول protein energy malnutrition. There will be decreased basal metabolic rate، الهارت ريت يقل، blood pressure يقل، وبالفيميل يصيرون amenorrhea. الكوزز مالته هو inadequate food intake, chronic disease, anorexia nervosa and alcoholism. بالchildren يقسموه إلى marasmus, Kwashiorkor and intermediate form. المرازمس هو disease of infancy resulting from early weaning onto a diet deficient in protein calorie. يفطموهم من وقت. The main feature هو growth retardation, wasting, loss of subcutaneous fat, edema usually absent, wizened face, premature aged appearance and patient will be alert and hungry. بينما الكواشيوركر يصير لنا بالolder children اللي هي من 18 إلى 24 month weaning to high carbohydrate low protein diet. الفيتشر مالته growth retardation, loss of skeletal muscle mass, subcutaneous fat present, generalized edema, moon face, skin exfoliation, straight friable depigmented hair and atrophy of the hair follicles, fatty liver, anemia, vitamin deficiency, and the child will be apathy and irritable. هذا هو الكواشيوركر يكون edematous زين، بينما المرازمس يكون ثن. هسه اشوفكم هاي الصورة، هذا الثن، هذا مرازمس. اكو كواشيوركر مرازمس ستيت، هذا اللي هو فد اكستريم يعني هيبريد ستيت ان بتوين. هذول شو يصيرون؟ احنا المرازمس عادة يكون ثن، بينما هذول بالعكس الهيبريد يكونوا انديميتس مرازمس والكواشيوركر يكون ويستد. There will be marked predisposition to infection like TB, viral infection, diarrhea due to the overgrowth of normal flora, reduce T lymphocyte activity. All these will be or causing impaired delayed hypersensitivity and complement system response فتسوي لنا الانفكشن. هذا هو طبعا يكونون liable for infection خصوصا الفيرال انفكشن من ضمنها الميزل. هذا هو الميزل. التريتمنت هو control infection, replace deficient diet and follow up of the patient. Effect of the disease on a nutritional status. There will be injury and infection associated with hypercatabolic response. Two main group of mediators اللي هي الهرمون glucocorticoid adrenaline glucagon عفوا lead to the mobilization of carbohydrate and fat store as a source of energy, and cytokines interleukin 1 and 6 tumor necrosis factor lead to the fever and gluconeogenesis. Hypermetabolic state required provision of extra energy, substrates and protein, 10% for abdominal surgery, 25% for major surgery complicated by sepsis, 50 to 100% accidental trauma and widespread full thickness burn. This is the cancer cachexia. Most of the patients dying of cancer having evidence of protein energy malnutrition أو بما يسمى بالcancer cachexia. هذا هنا إنه الانوركسيا راح يصير عندنا reduce of nutrient intake, reduce absorption و leading to the cancer cachexia وبيها catabolic state تزداد, الكيموثيرابي اللي ياخذه, competition with the cancer cell. Disease affecting nutritional state including GIT disease اللي هي malabsorption syndrome, gluten sensitive enteropathy, surgical operation, enterocutaneous fistula and artificial feeding. Renal disease like the renal failure lead to the restriction of protein diet and protein deficiency. Liver disease, acute hepatitis اللي هو يسوي لنا carbohydrate increase and decrease fat and protein diet. Chronic liver disease and hepatic failure, sodium intake should be decreased. Pulmonary disease, difficulties in chewing and swallowing. Inborn error of metabolism اللي هي تصير لنا بالchildren. زين, هذا هو الارتفيشال فيدنج في حالة البروتين انرجي مال النيوتريشن. وقعت عندنا الفيتامينز. احنا الفيتامينز نقسمها الى fat soluble vitamins اللي هي الاي والدي والاي and K, and water soluble vitamin اللي هي البي and C. Factor that causing vitamin deficiency هو reduce intake, wrong procedure for cooking and storage of the food, impaired GIT absorption, increased metabolic demand and iatrogenic. مثل عندنا drugs الايزونيازايد that interfere with the B6 absorption اللي هو ينطوه في حالة التي. نجي على الفيتامين A. شنو الفانكشن مالته؟ هو for the mucus secreting epithelium and normal vision. الديفيشنسي يسموها xerophthalmia, drying, wrinkling of the cornea, corneal ulceration, liquefaction يسموها keratomalacia, lead to the scarring and blindness. Recurrent respiratory tract infection and renal stone formation. هذا هو الفيتامين A deficiency بالعين. شوفوا هذه المناطق اللي صاير عندنا بيها whitish discoloration. زين, هذا بما يأثر على الآي. وهنا على السيل ديفرنشيشن أيضا يأثر لنا عليها lead to the pelvic keratinization of the kidney. زين, keratin debris and stone formation. فيتامين دي. فيتامين دي الفانكشن مالته maintain normal plasma level of calcium and phosphorus and achieved with help of parathyroid hormone. من يجينا الفيتامين دي؟ من الدايتري سورس والاندوجينوس سينثيسيس. السكن من تتعرض للسن لايت تحول لنا البريكيرسر الموجوده بالسكن عن طريق اليو في اوف ذا سن تحول لنا ال7 دي هيدرو كوليسترول الى فيتامين دي. هذا السورس مالته. الفيتشر اوف ديفيشنسي يسوي لنا ريكتس بالتشيلدرن واوستيوماليشيا بالادلت. الريكتس هو bone disease produced by hypovitaminous D characterized by failure of normal mineralization of newly formed osteoid and defective mineralization of epiphyseal cartilage and leading to the skeletal deformity. لذلك يصير عندهم bowing of the leg بالريكتس. Osteomalacia, failure of bone mineralization, there will be excess unmineralized matrix, abnormally wide osteoid, تطلع لنا radiolucent بالاكس راي و leading to the fracture. هذا هو bowing of the leg in case of rickets in the children. هذا bone biopsy في حالة الاوستيوماليشيا. شوفوا النورمال بون يكون الاوستيويد مالته thick، بينما هنا الاوستيويد demineralized. زين، فهذه يسموها الاوستيوماليشيا. The causes of deficiency هو decreased dietary intake, lack of cutaneous exposure to the UV light, chronic renal failure and malabsorption. فيتامين E الفانكشن مالته هو antioxidant, neutralizing free radicals generalized by many cellular redox reaction, minimize free radical induced membrane lipid peroxidation, protective role important in nervous system, preventing red blood cell lysis, and may have a role in the prevention of atherosclerosis. Deficiency state leading to the peripheral neuropathy and retinopathy. Vitamin K important for the synthesis of clotting factor اللي هي 2, 7, 9 and 10. Synthesized by intestinal bacterial flora, provide body with its requirement and deficiency is uncommon. شو وقت يصير الديفيشنسي؟ neonate receiving broad spectrum antibiotic and patient receiving coramine. Clinical manifestation of the deficiency: hemorrhage, ecchymosis, gingival bleeding, melena, and hematemesis. Water-soluble vitamin including the thiamine اللي هو cofactor for oxidative decarboxylation for ATP synthesis and pentose phosphate pathway, maintaining integrity of cell membrane. Causes of deficiency: it is due to the long-term parenteral nutrition and severe diarrhea. الفيتشر يسوي لنا polyneuropathy, dry periphery, cardiac dysfunction, wet periphery and edema, and CNS dysfunction. هذه تاخذوها بالأطفال إن شاء الله بالتفاصيل. This is the parenteral nutrition. هذا هو الدراي بريبري، يصير عندهم بريست دروب، كرونيك بايلون عفوا كرونيك بولي نيورايتس يسوي ريست دروب اند فوت دروب. This is the wet periphery، يصير عندهم هارت فيلر اند اديما اند ساينوسيس. فيتامين بي 2 اللي هو رايبوفلافين، الفانكشن مالته فلافوبروتين essential for normal cell metabolism and coenzyme for many reactions. الديفيشنسي يسوي cheilitis, glossitis, seborrheic dermatitis and keratitis of the cornea. This is the cheilosis اللي هو inflammation and ulceration of the angle of the mouth. This is the glossitis, inflammation of the tongue. Niacin, nicotinic acid, the main function in the oxidative metabolism, constituent of two coenzymes involved in the metabolism of fat, carbohydrate and amino acid. Features of deficiency: it is يسموها 3D، هي البلاغرا يسموها 3D: dermatitis, diarrhea and dementia. glove dermatitis يعني بالهاند والفيس, neck, arm and feet. Erythematous burning lesion and scaly lesion with irregular pigmentation. This is the type of dermatitis. هذه هي البلاغرا. Vitamin B6 اللي هو البيريدوكسين, function metabolism of amino acid, heme synthesis, stabilization of muscle phosphorylase. Causes of deficiency: pregnancy and lactation, mother and infant, chronic alcoholism, drugs like penicillamine and isoniazid. Feature of deficiency including cheilitis, glossitis, seborrheic dermatitis and peripheral neuropathy. فيتامين سي أو الاسكوربيك أسيد، الفانكشن هو reducing agent, stabilization of collagen, synthesis of noradrenaline and absorption of iron. Deficiency cause: الديزيز يسموه سكيرفي، يسوي لنا skeletal changes, hemorrhage, gingival bleeding and impaired wound healing. This is the ascorbic acid deficiency. شوفوا gingivitis, it is very ugly. الكونسيكونس عفوا of vitamin C deficiency هو impaired collagen deposition إذا بالتشو وبالبون وبالجم وبالwound healing. Minerals and trace elements including the iron، الفانكشن هو cellular respiration، هو الهيموغلوبين، مايوغلوبين، سيتوكروم، كاتاليز، بيروكسيديز، كلها يدخل بها الايرون. الديفيشنسي يسوي لنا انيميا، susceptibility to infection, reduced capacity of physical activity, abnormal thermoregulation and cholinekia. هذه هي الكولينيكيا اللي هي السبون شيب فينجر، يصير لنا في حاله الايرون deficiency. كالسيوم total content بال 70 kilogram weight of the body, about 1030 gram. 99% of calcium in the body within the skeleton, in the bone. The function is maintaining the skeleton function, contraction, relaxation of skeletal and cardiac muscle, neuronal excitation, neuromuscular transmission. Deficiency lead to the neuromuscular irritability and tetany. This is the hypocalcemia or tetany. This is the carbopedal spasm or the trousal sign, which occur in case of hypocalcemia. Magnesium maintain neuromuscular and nervous transmission. Deficiency lead to the weakness, irritability of the muscle. Tetany, cardiac arrhythmias. Copper involved in the cytochrome oxidase, superoxidase dismutase, ceruloplasmin, heme synthesis, collagen synthesis, melanin production, dopamine beta hydroxylase neurotransmitter. Excreted in the bile and feces, deficiency leading to the hypochromic microcytic anemia, neutropenia, and skeletal disorders. Wilson disease, this is disorder of copper metabolism, pair of autosomal recessive gene, increasing the amount of copper accumulate in the liver, leading to the cirrhosis, and the lenticular nuclei of the brain, leading to the neurological manifestation, and in the kidney and eye. بالآي يسموها الكايسر فليشر رينجز of Wilson disease اللي هي هذه مؤشر عليها طلعت لنا فد براون ring around the cornea. هذه هي الكايسر فليشر ring due to the accumulation of the copper. Zinc involved in the tissue repair, wound healing, and reproductive system. Deficiency leading to the hypogonadism, infertility, impaired wound healing, skin rash, and growth retardation in the children. This is the zinc deficiency causing characteristic erythematous hyperkeratotic skin rash. شكرا جزيلا. هذه هي محاضرة environmental pathology or environmental disorder.